Knee osteoarthritis. When bone shape has changed, what can a joint injection actually change? This video separates 4 different issues: structural changes, inflammatory responses, symptoms, and the purpose of an injection. First, an important boundary. A joint injection does not return osteophytes or bone shape to their previous state. The injection scenes are conceptual CGI used to help organize the information inside the joint. They do not show injection angle or depth, or how a treatment is selected. With knee osteoarthritis, it is important to look at the whole joint rather than one part alone. Changes in the cartilage and meniscus, uneven loading, and remodeling of the bone beneath the cartilage are related findings. The bone may appear denser, and osteophytes may be present. These findings are not treated as a fixed sequence that must always progress in one direction. Cartilage, the meniscus, loading, and the bone beneath the cartilage are reviewed as separate findings. Next is the inflammatory response. An inflammatory response in the synovium may be related to swelling and pain. Synovial inflammation and remodeling of the bone beneath the cartilage are considered separately. Inflammation does not explain every symptom. Structural findings, inflammatory responses, and the symptoms a person experiences are reviewed as different pieces of information rather than grouped under one label. So what is the purpose of a joint injection? Joint injections differ by type, purpose, and supporting evidence. They cannot all be treated as the same simply because they are delivered by injection. The purpose of an injection must also be considered separately from whether structures such as bone or cartilage return to their previous state. Some injections, including steroid injections, are intended for short-term symptom relief. This does not mean that osteophytes disappear, bone shape returns to its previous state, or cartilage regrows. This video does not decide which treatment may suit an individual, how often it should be given, or how long any effect may last. It is important not to confuse the goal of short-term symptom relief with structural change. Cells and extracellular vesicles, or EVs, are also being studied, but their clinical effects and effects on joint structure are not yet settled. The explanation of short-term symptom relief for steroid injections cannot be transferred to cells or EVs. Something being studied is not the same as its clinical or structural effects being established. For that reason, assessment begins with a clinical examination and X-rays. MRI may be used when needed to look more closely at findings such as the meniscus or bone marrow lesions. Leg alignment and loading are also considered. X-rays, MRI when needed, leg alignment, and loading each serve a different purpose. This does not mean that everyone needs an MRI. To summarize, first, a joint injection does not return osteophytes or bone shape to their previous state. Second, an inflammatory response in the synovium may be related to swelling and pain, but inflammation does not explain every symptom. Third, joint injections differ by type, purpose, and supporting evidence. Some, including steroid injections, are intended for short-term symptom relief, while the clinical and structural effects of cells and EVs are not yet settled. A clinical examination, X-rays, MRI when needed, leg alignment, and loading help keep structural findings and inflammation separate. When a real public information page and its destination have been verified, the page for reviewing knee information will be linked in the video description and pinned comment. Symptoms and imaging findings vary from person to person. Diagnosis and treatment selection are made by a physician. Assess, organize, rebuild. Cellforce 1 Clinic, Tokyo.